Hey friends, welcome back. Today we're talking about a medicine that has helped millions of people worldwide, Zoloft, also known as Sertraline. It belongs to a group of medicines called SSRIs, short for selective serotonin reuptake inhibitors. In simple words, it works by boosting the serotonin levels in your brain, the feel-good chemical that controls mood, sleep, and emotions. Doctors prescribe Zoloft for several conditions: depression, anxiety disorders, panic attacks, obsessive-compulsive disorder, OCD post-traumatic stress disorder, PTSD, and even social anxiety disorder. In short, Zoloft helps bring balance when your emotions feel out of control. Zoloft usually comes as a tablet or liquid, and it's taken once daily. You can take it with or without food, but the most important thing is consistency. Same time, every day. And remember, never stop suddenly. Always follow your doctor's advice. Like every medicine, Zoloft can have side effects. Some common ones are nausea, dry mouth, trouble sleeping, sweating, or feeling tired. Usually, these improve with time. But if you notice anything serious, like extreme mood changes, thoughts of self-harm, or unusual bleeding, you should contact a doctor immediately. And here's a key point. Zoloft is not a quick fix. It may take a few weeks before you start feeling the real benefits. Patience, consistency, and regular check-ins with your doctor are the secrets to success with this medicine. Zoloft, or Sertraline, is one of the most trusted antidepressants in the world. It helps restore balance in the brain, reduce anxiety, and improve overall quality of life when used safely and under medical guidance. Thanks for watching. If you found this breakdown useful, don't forget to like, share, and subscribe for more health topics. Stay positive, stay healthy, and I'll see you in the next video.